Laboratory 7, we're going to learn about the muscles of the shoulder girdle and trunk. But as we now approach the muscle sections, we're going to learn some basic terminology that applies to the next 4 weeks, and it's muscle terminology that you would have seen from the lecture, and we're going to reiterate it here in this first lab. But before we start muscles of the trunk, and any muscles for that week, we really want to have a good handle on those bony landmarks that were presented in the last page of the lab prior to this. So you had a series of bony landmarks, and in those bony landmarks, you would have known some of them already, and then we're going to begin to learn the ones that we didn't know, and you'll see them appearing throughout these next couple of weeks. You'll also notice that if you look at the tables presented in these labs, the tables where the muscles with the origin, insertion, and actions, you'll notice those bony landmarks appear in a lot of those origin insertion sections. So that's what they mean. If you're unsure where they are, that's when you look back through your book or in your appendix section to learn exactly what those bony landmarks are, so you know where the origin and insertion of each muscle is. First thing we need to learn about muscles is the origin and the insertion and what they actually mean. What's the definition of these things? It's simple enough to say that it's an attachment of the bone. But which end is the origin and which end is the insertion? In the limbs, it's typically the more distal end is the insertion and the more proximal end is the origin. So origin at this end, insertion at this end in the arm for the most part, same for the legs. However, it's not as simple as saying proximal and distal, because a lot of muscles, even in the arms, run across, and in the trunk, they're running every which direction. They can be running up, they can be running diagonals, every which way. So the correct definition of the origin is the more stable bone or the more fixed bone. Now, if I think about that in the arm, I would say origin more fixed. I would say insertion more movable. So let's take the bicep brachii as an example here. So if the bicep brachii flexes the elbow, and we know if I just point up here, I say the origin of the bicep brachii is up here somewhere, and the insertion's down here somewhere. When I flex my elbow, it's this end here which is drawing towards its origin. The actual origin itself is maintaining a fairly fixed position. So we say origin, fairly fixed. Insertion is the one that's moving, it's coming up to the origin. Pretty simple in that sort of bicep brachii area. But when I look at things like through the trunk, if I'm in the anatomical position and I move my trunk by, like say, flexing my abdominal muscles, then it would actually be the top part which is moving and the bottom part which is staying relatively stable. So in a lot of the abdominals, we have a situation where the origin would be at the bottom and the insertion being at the top, because I'm moving the top towards the bottom. And then there's all kinds of different combinations where things are diagonal and they get harder and harder to determine. So we're going to teach you tricks along the way to help remember the origin insertions of those tricky ones, so we don't get them confused. But for now, we just remember the more fixed or stable and the more movable end being the origin and the insertion. The next bit of terminology we need to understand is muscle contraction terminology. So we can have a concentric, isometric, and eccentric contraction. Now these again follow on from the lecture, so we should have been introduced to them earlier. But if we contract concentrically, we're contracting with the muscle shortening. If we contract isometrically, we're contracting the muscle with no change in length. And eccentrically, we're contracting the muscle as it's lengthening. Now, again, we'll just start with the bicep brachii example here just to put this in a little bit of context. So if I take a dumbbell and I contract, doing a bicep curl, I contract my bicep brachii as I flex my elbow. This is an example where my bicep brachii is shortening, so it would be considered a concentric contraction. If I just held the weight in any position, like during that would be an example of an isometric contraction, because I'm contracting my bicep brachii to hold this weight in the position. Now, eccentric contraction gets a little bit more difficult to understand. It's simple enough to say as I lower this weight back down, that's an eccentric contraction of the bicep brachii. It's lowering the muscle, it's controlling this lowering process. So even though my muscle, my elbow here is extending, it's actually the bicep brachii which is controlling this lowering process. I'm essentially lowering it slower than gravity. So it'd be similar, like if I put this in a different context, it'd be like I'm lowering it, I'm contracting this as it begins to lower. This is a single joint exercise, so can be easiest to see in this type of activity. But when we start to make this more complex with things like the pull-ups and the squats, we can see this gets a little bit more difficult. So if I'm in a pull-up type position and I'm just looking at the elbow here, I'm discounting movements of the shoulder and shoulder girdle. If I were to pull myself up, again, I would see a concentric contraction as my bicep brachii shortens. If I were to hold at any time during that, I would see an isometric contraction. And then as I lower back to my starting position, I would see an eccentric contraction. But we can't think of this as up and down or which movement I start in, because I can start eccentrically also. So when I'm in a squat position, if I begin to squat, I'm lowering myself. Anytime you really see that lowering is likely to be an eccentric contraction. So in the squat, I would lower myself first, being eccentric contraction of the majority of the lower leg muscles. And then if I were to pause at any point, it would be an isometric contraction. And then if I return to my starting position, it'd be a concentric contraction. There's also other muscle terminology we use which describe the role in which the muscle plays during contraction. So the first one we come across is the agonist. Now again, we've seen these in the lectures. We're going to have another touch on them here in the laboratories. So the agonist, it's another way of saying prime mover. It's the main muscle or muscles which perform this role. So I said muscles because it often occurs that you can have more than one agonist. So in different angles, in different positions, sometimes one muscle might be the agonist and sometimes another muscle might be the agonist. For simplicity reasons, in your lab books, we've got an A next to, in your tables, an A representing the agonist for this action. And we've grouped them together, so if there's more than one muscle, it's the agonist in different positions, we've just put them both for the agonist. Right, so you need to know what movements occur and which ones are the agonists for each muscle. So an agonist being a prime mover. So if I think about elbow flexion, I've got two agonists that control this movement. I've got the bicep brachii and the brachialis. Both are the agonists for elbow flexion. I've also got the word antagonist, which means it would oppose or reverse this particular action. So as I'm flexing my elbow, and I've said the bicep brachii and the brachialis are the agonists of elbow flexion, I've got the tricep brachii, which is the antagonist. So that means during elbow flexion, it would be the tricep brachii that would oppose or reverse that movement and extend my elbow. Okay, so that's agonist, prime mover. Antagonist would oppose or reverse. Then I've got muscles that are termed synergists. And what synergist means is it aids or helps the agonist perform its action. So I've mentioned before two agonists for elbow flexion. There's other muscles that also work during elbow flexion, such as the pronator teres and the brachioradialis. These two muscles would be termed synergists during elbow flexion. That means they help the other agonists during elbow flexion. And finally, we've got fixators. Fixators stabilize the origin or the base of the agonist. So in the example of this bicep brachii, we've said it's one of the agonists. A fixator would be a muscle that is stabilizing the base of it. Now that means any real muscle that's crossing over that bicep tendon or stabilizing your scapula where your bicep attaches to. Now, depending on the situation, this could be plentiful. There could be many, many fixators. So this course doesn't really go into all the fixators during all the movements. We just really need to know what a fixator is. So we're asked definitions of fixators, but you don't have to know all the different fixators that are stabilizing all the agonist origins throughout the exercise. So 4 different terminologies: agonists, antagonists, synergists, and fixators. And importantly, muscles can fall into each of these categories. It doesn't always fall into one. It depends on the movement. Muscles can, in certain movements, be one thing, but in other movements, be another thing. So now as we talk about muscles of the shoulder girdle, I'm going to put up some pictures and talk about each of the muscles and the fiber direction to help us understand what these muscles do. In this description of the pictures, you're going to see these muscles appear in your tables. I'm going to do them in no specific order, so you're not going to be able to just work down your table in every instance. So don't worry about that, they all will appear. And because we're doing muscles of the shoulder girdle and trunk, at this point I'm going to talk about some muscles of the glenohumeral joint as well, because a lot of them cross in. But you'll see those muscles appear in the tables for next week, so just bear with me for a little bit here. So I'm going to start by this first muscle, which is the sternocleidomastoid. Sternocleidomastoid appears, it's this muscle here on that sort of diagonal front part of your neck. It is the muscle responsible for flexing your neck. So this is one of the first examples where we see the the origin being at the bottom, the insertion being at the top. As we draw our neck into flexion, we see the more movable end coming closer to that origin. So the sternocleidomastoid, responsible for neck flexion. Now as we look across the back, I'll just look at this back view. We've got some muscles of the shoulder girdle, we've even got some muscles of the glenohumeral joint on here, and I'll talk through each of these. So for starters, we've got the trapezius. It's one of the biggest muscles across the back. It's a diamond-shaped muscle. Now we see this is one of the muscles here that primarily moves the shoulder girdle. Now it's an example where the origin occurs down that sort of vertebral column region, with the insertion being on the scapula. So we see movements of the scapula occurring with the trapezius. But it's an interesting muscle here because the fibre directions are going all kinds of different directions, which means it has all type of different actions. The muscles the fibres in the top part are moving diagonally up. So if those muscles were to contract, we would see the trapezius elevate the shoulders. The midsections, they're running straight across, so we would see the trapezius retract the shoulders, so draw them back together. And we'd see these muscles at the bottom dragging that scapula down, so they would depress the shoulders. There's another one in there, your books you'll see, which is upward rotation of the scapula, and we haven't really talked a whole lot about this. Upward rotation of the scapula would be that type of action. Sort of lateral rotation is the same as upward rotation. We can see the bottom border of the scapula sort of winging out to the side. So the trapezius does this because as the trapezius pulls on that top portion of the scapula begins to wing. So that's what upward and in downward rotation actually means. So we see it clearly for the first time in this example. So we've got the trapezius doing that. Levator scapulae is an example of a muscle that also attaches to the top of the scapula, and it too elevates. So we see it elevating just like the trapezius elevated. So those two have a similar action if you're only looking at the top portion of the trapezius. The rhomboids occurring between the shoulder blades, they're responsible for retraction. And on different pictures, you may see them broken into rhomboid major, which is the bigger of the two, and minor, which is the smaller of the two. For the purpose of what we're doing, we'll just group them together and say they're the rhomboid muscle group. So rhomboids will draw our scapulas together and retract our shoulders, much like the middle portion of the trapezius. If we come down here to the latissimus dorsi, we would see latissimus dorsi coming up from the lumbar and thoracic vertebral region and actually attached to the front of the humerus. And a lot of people might not have thought that at first look, so it's coming up and it's actually attaching to the front of the arm. It's really interesting because because it's behind the shoulder, it will work back to draw our shoulder back, so extend our glenohumeral joint. But because it's attaching to the front, it actually plays a role in medial rotation as well. So that's the interesting one here, medial rotation, because it's on the back, but it's turning our arm inwards. That's because of where that origin, so that insertion there is occurring. It's on the front of the arm. It's a really interesting one because when people go to the gym, and you see it all the time, people doing, say, like a chest day, they're like getting on the bench press and they're working a lot and they're drawing their shoulders in that protraction position, which is what happens when you work a lot of that chest area. And then they think, okay, I'm going to go to the gym and do the opposite here to balance my shoulders out. So what they might do as a bit of a track is do heaps of latissimus dorsi work, so like a lat pull down or something like that. And all that really does is draw that shoulder into more internal rotation. So drawing that shoulder more so. It's actually inserting very, very similar position to where the pectoralis major is. So it'll both medially rotate the arm. So instead of doing something like a lat pull down to combat that sort of internal rotation that's occurring, you'd be doing something like the rhomboids or some of our external rotators that we'll talk about later to set the shoulders back in that retracted position and externally rotate that upper arm. Pectoralis major, which I mentioned before, we see the origin. This is a muscle that's occurring to the glenohumeral joint because it's actually attaching to our humerus. So we'll talk more so about that in later weeks, but you can clearly see on this particular picture, origin being clavicle, sternum and ribs, and then it attaches to that front portion of the humerus. So it will play a role in flexing the arm, it'll play a role in medial rotation, and also adduction along with the latissimus dorsi as well, because they're both on the trunk, drawing our arms in. Over here, pectoralis minor, right, shares a similar name with pectoralis major, except major versus minor. It actually has quite a different role. It has a different role because it actually isn't touching the humerus at all. So it's not a muscle of the glenohumeral joint, it's very much a muscle of that shoulder girdle. Muscle of the shoulder girdle because it's going to help move that scapula. And remember, when we're talking shoulder girdle, we're talking the scapula and the clavicle. So it's attaching from the ribs to the coracoid process of the scapula, which means it's going to draw forward. So when we think about pectoralis minor movements, we're thinking about drawing the point of that shoulder towards the sternum. So protraction, and also it downwardly rotates the scapula. So serratus anterior, often referred to as the boxer's muscle. It's attaching to that front or inside border of the scapula and to the ribs. But in this movement, the ribs don't move. So it draws the scapula forward. So it protracts the scapula. And it's called the boxer's muscle. Boxers is not like as in a box of cardboard, but boxers in it, you're going to punch someone, because it's working that forward protraction, which is very much what happens when you punch someone. So it often gets nicknamed the boxer's muscle. So when we look at the muscle man here in general, we notice that there's actually different layers present. So we see this is the most superficial layer, and then there's layers taken off this side of the body. So you'll see deeper. We know it's deeper because you can see ribs present here that aren't present there. And that's the case for the trunk muscles, both front and back. So most superficial and a layer removed. We'll start by looking at the sternocleidomastoid, which is this muscle coming up here from the manubrium, which is responsible for flexing the neck. So it would be the agonist in neck flexion. Now moving down in the order as presented in the tables in your book, we've got the trapezius. Now we see the trapezius on this side again, it's the most superficial. I've now rotated the model here. So over here is one layer removed where you see the ribs, and over here you've got the most superficial layer. You've got this triangular type appearance of the trapezius, means it elevates. It's actually the agonist of elevation. It depresses in these lower fibers here. It's the agonist of depression, and it upwardly rotates the scapula by attaching the top here, these superior fibers, pull on the top of the scapula, which is buried deep under here, upwardly rotating. So it's also the agonist of upward rotation. Now these middle layers or fibers of the trapezius help to retract the shoulder. So they draw this scapula close together or closer to the spine. It's not the biggest muscle in this area, which means it's not going to be the agonist of shoulder retraction, but it retracts all the same. So next on our list there is the levator scapulae. We see the levator scapulae attaching to the top part of the scapula here. It's going to be responsible for elevating the shoulders, right? But not as many fibers moving in that upward direction as the trapezius, so it would be considered a synergist of shoulder elevation. We've got our rhomboids, which are these two sections down through here, attaching the vertebral, so that the thoracic vertebrae to the scapula. A lot more fibers than the central portion of the trapezius, so the rhomboids are actually the agonist in shoulder retraction. So we've got the serratus anterior here on the side of the body. I've removed the arm so you can see it more clearly. It's attaching to the medial side of the border of the scapula and around to the ribs. So as the ribs don't move during this action, the serratus anterior will shorten and draw this scapula forward or protract. So again, we call it the boxer's muscle due to its protraction. It's actually the agonist of shoulder protraction. We've got the pectoralis minor, this traveling from the ribs up to the coracoid process of the scapula. Scapula is removed in this because I've taken off the arm, but the pectoralis minor is the agonist of downward rotation of the scapula and also protracts the shoulder as well, so to be considered a synergist in shoulder protraction. So in our next activity, you've got an opportunity here to describe or write down an exercise that would activate or work each one of these specific muscles. So have a go at that before progressing, and you can also label the picture at the bottom of the page. So now we're looking at the actions that you might have come up with. There's lots of infinite answers, and this is not a type of subject that we need to know every single gym-based move. You could have nothing to do with the gym to answer this, but I'll just go through some of the obvious ones that you might have picked. So trapezius, what a lot of people might say here is shrugs. right? Which is, say, holding weights in your hand or just shrugging your shoulders up, even without weight, just shrugging your shoulders up. Whilst that's true, absolutely it does shrug, you'd only actually be looking at that top portion of muscle fibers during the shrug if you went trapezius. So trapezius, a number of different moves will activate this. Any type of row, whilst it's not the agonist of retraction, it'll still work during any kind of retraction. And to get the downward fibers activated, you might do something like the chin up. Chin up might work to draw that scapula back into depression. So as we go over, we've got levator scapula, really just anything raising the shoulders is going to be in here. So shrugs is the obvious one, just shrugging your shoulders. Even if you didn't know the answer, you're sitting there going, I don't know, like straight away you've done levator scapula, so you'd be correct. You've got things like rhomboids, really any kind of retraction of the shoulders. Rows is probably the main one that people do in here. Not just a weighted row, but even just going out and rowing a boat. Anything where you're retracting those shoulder blades back together, you're really working the rhomboids. On your picture as well, there's two labels for the major, minor. Just label them as one as the major. You've got the serratus anterior, boxer's muscle, anything that protracts. So even if you point it or push someone, you're actually also using that serratus anterior. So anywhere where the shoulders protract forward, serratus anterior. Pectoralis major, we haven't really talked about that much at all, so don't stress too much if you got to that point and had a bit of a hiccup. But it really, anything with that horizontal adduction type action. So a push up will do it, any kind of bench work, anything where this part of the shoulder is moving here, it really is a clear agonist of that horizontal adduction type movement. So that one we'll learn next week a little bit more, but if you had a bench or a push up, that would have ticked off that pectoralis major box. So the erector spinae is a very important muscle group. A lot of people consider it like your back abs, if you like. So your abdominals on the front, the erector spinae matching those movements on the back. So the erector spinae, you'll notice it's the first one in your table, but it actually represents three muscles making up a muscle group, erector spinae. So the three muscle columns that are going from the top right to the bottom are the iliocostalis, the longissimus, and the spinalis. And there's space on the next page where you can answer these questions, representing the three muscle columns that make up the erector spinae. I'll just flip over to show you this in colour. That I know it's a bit more of a sketchy picture, but you can see the three muscle columns, iliocostalis, longissimus, and spinalis, arranging themselves from the most lateral to the most medial. So there's a number of different roles of the erector spinae muscles. So the erector spinae muscles, obviously being back abs, reversing what the abdominal muscle would do. These are the agonists of trunk extension. So if I'm in a sort of bent over position and I were to stand up, this is my erector spinae at work. The spinalis specifically has another role, which is helping, as you notice, that muscle column runs straight over where that spine is occurring. So it plays a role in helping to stabilize the spine and holding those discs in place. Now, when we talk about actions of the erector spinae, we've already said agonist for trunk extension, but what role does it play during trunk flexion? And the answer really depends on how we're flexing the trunk. If we were doing a sit-up, that's an example of trunk flexion, where we're going, say, against gravity. But if I were to just bend over, that's a very different situation. So if I saw something on the ground and I lowered myself down to pick it up, and I asked you, what is the role of my erector spinae during this movement? What might you say? I'm bending over, so I'm flexing. Do you think the erector spinae is actually playing a role here? If you answered yes, you'd be correct. Because what's actually happening here, I said that word lowering, and as I mentioned before, anytime you see lowering, there's an eccentric contraction going on. So it's actually, in this example, the erector spinae, which is eccentrically contracting to control that lowering process. It's not my abdominals at all flexing me here. It's gravity and the weight pushing me down with the erector spinae controlling this action. But we often hear about injuries when someone's bending up and picking up a really heavy object, and we hear of injuries in the back occurring, and the roles of the erector spinae help to describe this. So if I'm bending over and my erector spinae is eccentrically contracted, and I get to the very bottom of this and I'm hanging, and I'm just hanging loose, right? What muscles now would be working, or in what capacity, to let me hang in that position? So we think, a lot of people straight away are thinking, okay, he's not moving, maybe it's isometric. But that would actually be incorrect also, because I'm hanging in the position, I'm not actually actively controlling that or holding myself in a particular position. At this point, I'm actually hanging and just leaning on my vertebral column ligaments, which we learned in previous weeks. Those ligaments we talked about, literally the bearing of my weight is being supported by the ligaments. So, in this position, the erector spinae are doing very little, and as I mentioned, that spinalis playing that role in helping stabilize in these joints is doing very little to help hold that disc in and stabilize the vertebral column. So you're very prone to injury during that fully flexed position when you're lifting a heavy object, because as you begin to lift a heavy object, the spine's got very little support and you're vulnerable to that disc rupture or herniated disc that we've seen in the previous lab. So that's the role that the erector spinae play during this flexion motion or lifting a heavy object. So how do we prevent that? Keeping the erector spinae activated by not letting ourselves in that hanging type position. We might bend, with our legs and not our back to help maintain a more stable spine throughout its movement. We see down here in the bottom corner, and the next one on your list is the quadratus lumborum, often referred to just as the QL. So the QL attaching from the iliac crest to the lumbar vertebral column and also the 12th rib, it's actually the agonist for lateral flexion of the spine, or the trunk. Lateral flexion is when we bend side to side. That's our quadratus lumborum working to do that. On you would be that soft portion in the lower back. Often the physio's jumping on you, put the elbow in. That hurts quite a lot. A lot of people go in and get like their QLs released. That's actually what's going on here. It's the quadratus lumborum, the muscle in that lower portion of your back, primarily responsible for the lateral flexion of your trunk. So the next four muscles on the table represent the abdominal muscles. We've got the rectus abdominis, external oblique, internal oblique, and transversus abdominis. So these four muscle groups make up your abdominals, and the abdominals are pretty important. You've actually, on the next page, got an entire page devoted to questions on the abdominals. But let's first learn where they are and what they look like. So up the front portion, or the most anterior portion, up the middle of the stomach, you've got what's called the rectus abdominis. Rectus coming from the word up and down or vertical. So these represent the rectus abdominis, and they come together at this line in the middle here. This is a line of connective tissue called the linea alba. Not to be confused with Jessica Alba, linea alba is a Latin term just meaning white line. So you've got the linea alba connecting the majority of these abdominal muscles, but we've got the rectus abdominis straight up and down the front section of the body. Now in the middle section, that's the only layer. They're quite big muscles, but in the walls of the abdominals, it actually goes 3 layers deep. And remembering that this side is the most superficial, this side we've taken off a layer, so you can see the ribs here, so there must be a layer removed. And you can see the fiber directions on both of these are different, because this muscle here is representative of a different muscle here. These ones here are the most superficial. They're called the external oblique, and they're running like you would put your hands in your pockets or a V pattern. Now the V pattern helps us determine both origin and insertion of these muscles. So the origin being up here at the ribs and the insertion being here at the linea alba. So the connective tissue, the muscle belly is finishing about here, and then it's connecting to the linea alba via all this connective tissue here. So it's determined like a V pattern. You could describe it as a V. The external obliques, like you're putting your hands in your pocket, give you both fiber direction and origin and insertion. That was different to the rectus abdominis, which when you were to flex from that anatomical position, it'd be the top level moving and not the bottom. So the origin would be down here at the pubic symphysis, with the insertion being up here at the xiphoid process and ribs. So there is the first example here in the abdominal region where we see the origins and the insertion flipping from top to bottom and bottom to top. The next layer deep on the lateral walls would be indicated by one layer removed here, is the internal oblique. The internal oblique run from the iliac crest and inguinal ligament, which is a ligament connecting the iliac crest to the pubic region, and travels up towards the linea alba. So it can be described by an A-shaped pattern. So the fiber directions starting down low and then forming the insertion up high. So for the external oblique, we had a V pattern, but for the internal oblique, we had the A pattern. So the actual fibers and origins and insertions are moving in a different direction. The third layer deep and most deep would be these in here called the transversus abdominis. And these wrap around from the lumbar vertebrae and the ribs to the linea alba. So it's wrapping around from your back to the front. Being that circular muscle, as with most circular muscles, they work to contract by squeezing in. So they play a role in a lot of squeezing type motions, in addition to your flexion and your lateral flexion, things like compression. So think of every time you might compress your stomach muscles or something inside it, like you're like coughing, sneezing, laughing, defecating during pregnancy, things like that. You've got this contraction of the transversus abdominis allowing that. So it's a squeezing or a narrowing of the round type shape that they provide. Another way to do it as well, to learn the muscles, is you can notice that when we look at the cross section of the walls, you'll notice here, this was my external oblique layer. It's 3 layers. So external oblique, internal oblique, and the deepest being the transversus abdominis. On this side, this was my internal oblique, so moving up like the A-shaped pattern. You can see them, only 2 layers, that would be internal oblique and transversus abdominis. One side removed on this compared to this. So whilst you've got these key roles of flexion and lateral flexion and flexion for my rectus abdominis and the internal and external oblique, you've got another real different series of roles taking place with that transversus abdominis. So you should be able to answer all the questions around the abdominal muscles, but you've also got an opportunity to label the picture of each of these abdominal muscles. You see the first picture at the top of your page, which is showing something looking like this with different levels, where you see both fiber direction and depth. You should be able to label the middle series of 3 little pictures where you don't have depth, but you do have fiber direction. And then the very bottom, you should be able to label, just based purely on that horizontal cross section, the depth of the muscles indicating which one's which. And I'll give you a little hint for labeling of that bottom picture. Have a look at where the skin is, and that will give you the most superficial muscle, and you can work backwards from there. So as we conclude Laboratory 7, we've got a lot to learn. We've introduced a whole lot of new topics. We've got all this new terminology that we're using and that we're going to apply to the next 3 laboratories. And we've got a whole lot more names. The hardest part is all these new names of all the muscles and where they're going. So we need to know the name of the muscles, where they are on the actual model, the origin and insertion of these, and that goes hand in hand with the boning landmarks that we've started to learn over the past weeks. And also the actions, but not only the actions of the muscle, and remember there may be many, but also which ones are the agonists, right? So we're really looking through that, and we're noticing in those tables, the one with the A representing the agonists, we really have to stay on top of all the different actions and the agonists. And now there's a lot coming in future weeks. We've got the arm and the leg, upper and lower leg. So really getting on top of it now is a great way to get ahead and stay ahead in this subject.